I am now going to take you through an appreciation exercise. In this exercise, we will go through many parts of your therapy. Feel free to add anything particular to your situation, such as the names of your doctors or medication. Let's begin with your body. The body is an enormously complex apparatus, and it functions for the most part flawlessly with multiple backup systems. It has its own defense system built in, which functions mostly without your input. Appreciate all that your body does automatically without you having to think about it. Your heart beats on its own without you having to do anything. It speeds up, it slows down as needed. Appreciate your heart. You don't have to worry about breathing. Your lungs take in air and allow oxygen to transfer to your bloodstream, where it is transported to all your tissues and cells. All this is done without you having to think about it or do anything, awake or asleep. Appreciate your lungs. When you eat food, you do not have to think about the complex process of digestion. The food is broken down, and all the nutrients that are needed are stored, and what is not needed is eliminated. The protein goes where it needs to go, and the carbohydrates go where they are needed. You do not have to tell your body where or how to use these nutrients. Your liver detoxifies toxins automatically. Appreciate your digestive system. When you decide to walk across the room, your brain tells your legs to move, and you walk across the room without ever thinking twice about it. Appreciate how your body heals itself from something as small as a paper cut to something as complex as recovering from major surgery. Appreciate your body for all that it has done for you, how well it performs and sustains itself. Take the time to thank your body for getting you through this challenge. Your body is a wonderfully complex organism, constantly responding to changes in your system. It is striving to achieve balance and wellness, adapting to many circumstances. Think about a small issue, such as getting a splinter in your finger. Immediately, your body responds locally by clotting the blood in that area and sending white blood cells to clean up the area. So even though you've been told that you have an illness, be very mindful that your body is still working for you, doing what it has always done, healing itself. Your job is to support your body to the best of your abilities. One of these ways is by practicing these exercises and feeling the gratitude deeply. Now think about your doctor. Your last interaction with him or her may come to mind. Take a minute to appreciate that he is concerned for you. Know that ultimately he or she want what is best for you. Appreciate his experience and years of education. Appreciate his knowledge and compassion. Appreciate him or her for being there and for caring. Appreciate the nurses for their willingness to do a difficult job and their abilities to do the things that need to be done, to communicate with your physician, to help you with your needs. Appreciate their ability to start IVs and inject medications, their use of medications to limit the side effects of chemotherapy. Appreciate your nurses for being there and for caring. Appreciate the staff and volunteers who try to help us be as comfortable as possible. The ones that bring you the extra blanket or pillow, or a glass of ginger ale, or stop by to see how you're doing. There are so many people that want you to do well. Now take a minute to think of any other person who has assisted you and appreciate them for all they've done. Appreciate the pharmacist and all of their knowledge of the complex medications they deal with. Realize that the medications are mixed specifically for you based on your needs. Appreciate the medication. The most challenging to appreciate may be the chemotherapy. Appreciate the chemotherapy for shrinking the cancer. Allow it into your body in a positive way. Let it go where it needs to go and avoid the normal tissue and cells. Believe in this medicine. Know that it can cure you. Appreciate the company who makes the medication, the time and investment they made to develop the medication, the chemical engineers who thought of how to make the medication, the people who actually produce the medication, the people who box the medication, the truck drivers who deliver the medication, and on and on. Realize how many people are involved in order for you to receive this medication and all of your therapies. Appreciate all the medications that you are receiving, perhaps medication for nausea or medications to help build up your blood count or any other medicine. Appreciate that whatever medications you may need will be available to you. Know that simply because some people may experience side effects of a medication does not mean that you will have the same side effects. If you do have side effects, try to even appreciate the side effects. Know that they are a sign that the medicine is there, doing what it should do, shrinking the cancer. Now picture the chemotherapy as it begins to flow into your system. See it entering your system in a positive way. See it as a golden light entering your body and moving through your body. Allow it to go where it needs to go and do what it needs to do, avoiding the normal tissue and cells. Picture it as warmth and as healing. Know that you are cared for. There is so much to appreciate with what you're going through. Take the time to realize the things that are important to you and appreciate these things. Appreciate all that has been and is available to you. You now have permission to take care of yourself. Listen to your body. When you are tired, sleep or rest. When you're hungry, eat good, nutritious food. Take time to relax. Take the time to do things that you consider fun. Ultimately, support your body as it heals. Remember, you have a choice. You can choose to see this experience as stressful and awful with the cancer controlling your whole life. Or you can choose to see it as an opportunity to practice appreciation and forgiveness. So when you find yourself feeling fearful or worried, anxious or distressed, Choose again. Now, when you're ready, begin to move your arms and legs, and open your eyes.